Good afternoon, and thank you for tuning in today. On behalf of the University of California, San Francisco Alumni Association, the UCSF Department of Psychiatry, the Greater Good Science Center at UC Berkeley, the MindSight Institute, and the John W. Brick Mental Health Foundation, welcome to the 7th webcast of our series entitled Emotional Well-Being During the COVID-19 Crisis for Healthcare Providers. This week's topic is On the Front Lines, Compassion-Based Strategies. I will now turn it over to our host, Dr. Alyssa Eppel.
Thank you so much, Mario and John. Welcome, everyone, to this really special session we have today. I will introduce our speaker, Thupten Jinpa, in a bit, but as usual, I have a special guest for us first. So, and before that, a quote from you, our audience. We do ask our healthcare providers to send us a snippet of their experience as we travel through this unknown territory. So here we are in mid-May, and it may be the same challenge in, next month or the month after. Now it's about how do we go on each day with this mind of ours that can't deal well with uncertainty, and things are unfolding each day where we just can't make certain plans for the future. And that's very hard for many of us. So this is a quote from one of our nurses on the front line. This week I hit a grief wall, grief for the world, no group events, the landmarks of normal life gone, and economic devastation, the exposure of societal injustice and inequity, and the death of so many. So this week I find myself with tears right behind my eyes the moment I get even a little introspective. I'm doing everything that helps, connecting with loved ones by Zoom, spending time outside in my garden. And we live moment by moment. There is beauty and joy if I have the eyes to see. And I pray for those eyes today. Thank you for sending that. I really appreciate that quote. It so points to the importance of our perspective, where we put our attention, and how and when we process the entirety, the enormity of the grief that we are feeling and seeing. So I wanted to talk to one of our UCSF healthcare providers who has chosen to go to New York City. As you know, we had hundreds of providers apply to fly to New York City for a month and help in the Columbia Presbyterian Hospital. 25 were selected. They all came back this week, healthy, thank God. And today we get to talk with Sanjay Reddy, who is an associate professor of medicine and also works at the Osher Center as an integrative practitioner doing medical acupuncture. I had the pleasure of meeting Sanjay many years ago when we were both learning medical Qigong at Esalen. So Sanjay, welcome. Thank you for joining us. And I would just love to hear you share some of your experiences. It was wonderful to talk with you yesterday about what this is like for you. You are a hospitalist. You deal with people with serious illness as an inpatient often, and you often have to experience death, but not every day, not in these numbers, and not with what you described as this feeling of powerlessness over the course of the disease. You also are a contemplative practitioner. So I really have two questions for you. And the first is just, what was this like for you when you were chosen and you were going to New York for the month? How did you feel about this adventure that you opted into?
Well, so I think in the beginning, when they're asking for volunteers for New York, it was really nice that we were sending people over. And so I kind of volunteered impulsively in the beginning. And then as I thought about it more, I'm glad I did and was able to. There was a sense of, like a fear of practicing that I haven't had before, or of exposure. And so that was something new. I think because even during flu season, we're not that scared of getting the flu. We'll take our precautions, but um, it's not like I think about every flu season. Oh, this could be the flu season where I'm going to get sick and that's going to be it. And so I think that's something unique with COVID as well as how scared people were 4 weeks ago before we left. I think what we realized is all of us expected that we were going to get it while we were there. And so I just kind of made, but even before COVID, I think the fact that we're all going to, at some point in time, that the nature of being alive is that we're going to die. So that wasn't a surprise. It was just, it felt more pressing than usual. Prior, when this first happened, had some heavy conversations with family and friends about death and preferences, and so had more of those. But I had a fantasy I was going to write love letters to all my family and friends, telling them how I felt and thought about them in case I didn't have the opportunity to later. But I mostly just started those and didn't really make much progress.
Right. So what is it like to be back here now in terms of just thinking about life and death and COVID and, you know, you as a person, you as a practitioner?
Well, so I think it is reassuring that none of us got sick that went. And so I think the with proper equipment and preparations as a practitioner, maybe it is something that we worry about more in the community than we do worry about at work. And so that was actually just a side for everybody who is worried about it. It does seem like what we're doing is working. I think this is a big opportunity for us as a society to embrace our innate mortality. And then rather than, the hardest part I think about being there was having all of these end of life conversations when people couldn't breathe and were isolated from their friends and family and were by themselves and talking to strangers. And I think that for all of us was the hardest part of it. And so knowing that that's something that we can prevent, we can't necessarily prevent who's going to get COVID and who's going to die from it. But we can prevent not having these conversations in a more comfortable setting where it's not a sort of panic state. And I think that's something that would be really beautiful if that came out of this, where we became more comfortable with the fact that we're, at some point in time, most of us are not going to die from COVID, but at some point in time, we are all going to die. And it's a reasonable conversation to have earlier in our life.
Mm. It's a terrifying topic that we avoid completely as a society and hide from. And I think in our common humanity over the last few months, we've all felt the vulnerability, the unpredictability of life, our own, others. And I love your idea of having more open conversations about death, and that can help us both with the process, but also with how we live. And I will just say I had a very, small experience. I know it's a big part of Tibetan Buddhism, and we'll talk about that later too, to actually live with the idea of death so that you don't fear it and that you live more fully. And I did have a short experience with the meditation that led us through the idea and the process of dying. And it did help me both practically. I had a living will after that. I had a lot of clear thoughts of things I wanted to wrap up, even gratitude toward people, letting them know now so that there would never be a too late, as well as the practical aspects. So I do recommend these conversations, although I do agree with you, they should be guided and we should have more knowledge about how to talk about death.
Yeah, I think it's a tough topic to just be told to talk about death without knowing what the options are. What does dying in America look like for most people?
We have a UCSF website with a lot of resources, so this is something we can think about, pointing people to some resources there. Sanjay, what was it like for you just self-regulating? You obviously deal with, suffering and acute stress in your career, in your job. And I'm just wondering what you use during the day. You said you brought your cushion to New York. What was that like? What would it have been like if you didn't have daily meditation?
Mm-hmm. So I think the meditation part was really helpful, especially in the morning, because I would do it before I went to work. And so it was just kind of wake up, quiet down, and then start the day. And so I think that was a really nice time to kind of clear things out. I meditated so much more consistently in New York than I do in San Francisco. And so I think having the routine was helpful as well. It was also really helpful to have the colleagues. And I think like how inspirational our New York colleagues were that we came to help was probably one of the most powerful things, I think, in seeing that the source, one of the sources to relieve burnout and to support each other is actually our colleagues, and being able to see what they're able to do, that they just kept showing up to work when it just kept getting worse. And that sometimes it's hard for clinicians to be able to see to not be hypercritical of ourselves. And so to be able to recognize the light in other people is easier a lot of times. And so I think that was a big source of strength too. And just knowing everybody's really doing the best they can, and job descriptions have gone out the window. And so everybody's pitching in. I think that source of community, particularly when we're isolated from each other in other ways, was really powerful too.
That's so beautiful. Thank you for bringing that up. There's always technology and individual strategies, and then there's support and togetherness, which is kind of the the biggest thing we can do for wellness and for feeling safe. Thank you so much, Sanjay. It's
Thank you for having me.
Thank you for your service, for everything.
Thank you. Good to see you.
I'm next going to introduce our moderator, Eve Eckman, who you know. She was on the first webinar with me. Eve is a dear friend, and she's also, she's a PhD in social work. She is a fellow at the UC Berkeley Greater Good Science Center. She's a clinical faculty at UCSF, and she's a director of Cultivating Emotional Balance, a training she does worldwide for service providers on working with emotions to prevent burnout. Thank you so much, Eve, for joining us. And next, I would like to introduce Thupten Jinpa Langri, who is a Tibetan Buddhist scholar, former monk, and has a doctorate in religious studies from Cambridge University. He's taught Buddhist epistemology and psychology, established the Institute of Tibetan Classics, where he's both editor and in-chief, and has written many works there. He's the chair of the board of the Mind and Life Institute, which is how I know him, because since I'm on that scientific advisory board. And he was really, this is an institute that fosters the dialogue between Western science and Buddhism, the science of the mind, from the traditional Buddhist methods of inquiry and understanding the mind, and then combining that with the brain science and the neuroscience, and how we tend to try to understand the mind from a more materialist way. So it's the integration of these two that has been a fascinating growing field that Jinpa has been there from day one, from one of the very first dialogues between His Holiness the Dalai Lama and a group of Western scholars, Francisco Varela, Richie Davidson, Roshi Joan Halifax, who you met on our series. He happened to be a young scholar in a Dharamsala at an audience of a Buddhist teaching with His Holiness when the translator was going to be there a day late. So they sought out the young scholar who could translate Tibetan to English. And that's how the relationship began in 1985. And he's been the main primary translator for His Holiness since then. And to watch a live dialogue is like nothing I've ever seen. It's kind of the exemplar of metacognition, to actually be thinking in two languages and be the mediator between these scholars and His Holiness. He published the Fearless Heart, which is on our psychiatry website, a book on how the courage to be compassionate can transform our lives. It was inspired by how Jon Kabat-Zinn's MBSR program has really become quite widespread and mainstream. So he developed a program, compassionate care training, integrating forgiveness, self-compassion, compassion, and the experience of common humanity, and has been training people in that, training trainers who are then training people in a partnership with UC San Diego. Once COVID broke out, he has started a daily experience for people that he or other practitioners lead in experiencing compassion and common humanity. So we'll hear about how that's different than just mindfulness, and how we can use some of these strategies of attention and compassionate training for our own social well-being. So thank you for joining us, your generosity and sharing your wisdom, and just the remarkable history that you've been part of and how that can inform us in this remarkable moment in time. Welcome.
Thank you, Alyssa, and welcome, Jinpa. So lovely to see you again. I'm really looking forward to our dialogue. We had a chance to start sharing ideas, and I know for both of us, it's extremely meaningful to be here with you all. So thank you, all of you who are here right now and who are showing up and learning how to fortify yourself so that you can be of service to those you serve as your patients and to your loved ones. So thank you all for taking this time and generosity for yourself. My first question for you is one that I hear every time I'm working in the healthcare setting, and that is, how can we actually sustain our compassion when the calls of suffering and difficulty are so great? And we saw with Sanjay, he had a face of brilliant, smiling resilience. So obviously there's a way that we can be in the midst of such suffering and challenge and still find that joy. It would be so wonderful to hear you talk about some of the methods and reflections that you've incorporated into the compassion cultivation training and from your work broadly across these different areas.
Thank you, Eve. And thank you, Alyssa, for introducing me. And at the beginning, I would like to express my deep personal gratitude to all the healthcare professionals who are serving us in this really scary time, a time of global pandemics, when even what we take for granted, many aspects of our modern life has been completely upended. And so we are truly living through very difficult times, and the healthcare providers are particularly at the forefront of really getting a handle on this crisis and sort of helping society and humanity come back to what could be called kind of a normalcy. So at the beginning, I wanted to thank you all. With a little correction to my bio, the initiatives with the UC San Diego right now, helping healthcare providers with during the COVID-19 crisis. I'm only indirectly involved because of my own Compassion Institute being part of the group that includes Sanford Institute for Empathy and Compassion, which is part of UC San Diego Health Sciences, and UC San Diego Center for Mindfulness. So the three institutions are part of it, and I happen to be the president of Compassion Institute. That's how I'm involved, but I'm not directly involved myself. And you're right, I mean, Sanjay's very moving account of his experience and the emotions and the thought processes that he went through was really powerful. So I really feel humbled because sometimes when I'm asked to share my thoughts for healthcare providers, particularly in this time of COVID, I find it's somewhat difficult because I talk about it, whereas the actual healthcare providers actually do it. And so that's why, for example, for the UC San Diego initiative, I said, bring me in when I'm needed, but I will, I don't have any particular expertise to offer. So, but what I have done personally is offer a free group sessions through the Compassion Institute where ordinary people who are feeling uncertain, overwhelmed, afraid, confused, to provide a forum where people can come together. So we've been doing some of these through Facebook Live. So the question, to respond to your question, clearly resilience is an important part of it. There is no doubt that we are all empathic creatures. We can choose to switch that off. And some individuals may be more dispositionally more empathetic as opposed to others. And we see that quite often in the way in which people react to, sort of sad movies and so on. So individuals differ, but still all of us have this empathic nature, because when we see someone acutely in pain screaming, everybody feels something, responds to it. So that's a very fundamental part of who we are. And humans are probably, among all the species, most empathetic creatures, partly because, we are we have way more understanding of suffering, whereas normal other animals only have to see sort of something really evident, but the humans can also intuit about psychological pain and all of this. So now, on the other hand, we are beginning to know, recognize, particularly through scientific studies, that excessive empathic exposure and experience can also be a source of burnout. So then the question is, how do we, sort of regulate empathy so that we don't lead to emotional burnout, because exhaustion, because empathy, when you experience empathy, you're really in the emotion zone. And emotions are powerful, but they're also exhausting. We all know that even exhilarating emotions are exhausting. Emotions are exhausting because they completely take over our mind when they arise, different from thought. Emotions are way more powerful. And so if we don't have a way of regulating empathy and finding a way to move from empathy to compassion, and if we remain primarily in the empathic zone, then we'll be resonating, vicariously experiencing the other person's pain. And clearly that is going to be difficult. So then the question is, how do you regulate it? And in the past, a lot of people have adopted, particularly professionals, have adopted a more suppressive method as a way of self-protection. And that's completely understandable, because we're not designed to be exposed to acute pain all the time. Now, healthcare providers, particularly those who are working in ICUs and all of this, has that kind of work. So then the question is, but it turns out that the suppression is in the long term not good for us. And in fact, one of the factors leading to burnout is actually identified as what is called depersonalization. So you suppress your emotional response, turn the other person into kind of a number or yet another patient kind of thing. And then you suppress your emotional response, and that it becomes another factor for burnout. So then the question is, where is that balance where we can allow our natural empathic response to kick in, but not get caught and stuck there? And this is where I think the idea of compassion comes in.
Thank you for that clarification. I think it's so helpful to understand that our emotions, both enjoyable and difficult, have a depleting factor on us. And we can really, what we want to do is understand the message they have to show us, which often is important. And one thing I've heard you talk about, I find so powerful, is that aspect of regulation really has to do with being able to cultivate our attention, our intention, and our awareness. And I'm wondering if you can say more. I think when people hear compassion, they might automatically assume it means just being nice. And
Yes.
just get specific about what are those skills, what are those tools that compassion helps us develop?
Well, emotion regulation is something that we naturally do anyway, because emotions don't last very long. So everybody has developed a natural way of regulating them. But often what we do is we use suppressive methods, because when it's a difficult emotion, we feel averse. Our reaction is averse. And when something leaves an aversive taste, we don't want to go there. So that's a very natural human response. But in any case, we do, and then sometimes we express it, we shout or scream. So we do regulate emotions. But what the idea of emotion regulation coming more from the contemplative practice side is a suggestion that actually we can learn to regulate them consciously with an intention, so that we can, bring awareness to emotions and then recognize the meaning of these emotions, because emotions are there as a powerful signal saying, hey, pay attention, something important is happening to you or around you. That's the role of emotion. And so normally what happens is that emotion arises, then we move on. So what the contemplative practice is suggesting is that actually we can bring awareness to our emotion. And when we bring awareness to our emotion, first of all, we learn to be with them without judging. Secondly, we also begin to recognize their meaning, so that we appreciate them. And then thirdly, we can modulate them so that in future through working at the level of intention, you can bring a specific type of emotional response. So this is where I think the combination of intention and awareness and connecting with aspiration is a powerful one. And this is the area where compassion training, the one that I developed at Stanford, which is now offered through Compassion Institute, it's called CCT, Compassion Cultivation Training. One of the main focus it brings is to somehow bring these three things together. Because at the fundamental level, when we are able to get down to our deeper aspirations, our aspirations, every single individual, our aspirations are actually quite good. We want our loved one to be happy, to be free of suffering. We want ourselves to have some peace and happiness. We also want, for our world, something good. So at the very fundamental level, the aspirations are fairly universal. And then, if we can find a way to inform our aspiration, for our aspirations to inform our intention, then intentions modify our emotions, and which manifest in action, our behavior. And the sort of the connecting link is really the awareness. This is why the contemplative practice, no matter which tradition you choose, emphasizes the role of awareness. And awareness is something that you cannot will. Awareness can only arise as a byproduct of paying attention and connecting with intention. And so in a given moment, we cannot will the awareness, but we can develop the skills and in some sense kind of orient our mind and bring attention and connect with our intention and aspirations. Then when the moment arises, awareness will kick in. And when awareness comes, then we can bring choice in a given situation. So that's why this is how the contemplative practice works. And that's why they're actually quite powerful when we use them.
Yes, such a beautiful way of clarifying the relationships of how we approach some of our more challenging emotion experiences. And I think bringing up another really common theme I've heard from healthcare providers over the last weeks, and honestly, over the last years, one right now that's more poignant, many emotions come up for healthcare providers around frustration and feelings of grief, but one that's coming up specifically right now is over guilt, especially for those who are not maybe doing the work of being in the front lines like Sanjay. Their aspiration is beautiful. They want to be of service, right? So they actually have part of what's needed happening. Maybe they even have some awareness. I'm aware that I feel guilty and I don't like it. So what else can they do to transform that feeling of guilt that I'm not doing enough into something that's helpful and productive?
Yeah, guilt is a very interesting emotion, actually, and it's a powerful moral sentiment. Guilt has a very important role to play in motivating us to live a more moral life. And also guilt is one thing that connects with our values. So when we find ourselves in a situation where, what we are doing is slightly out of sync with our deeper values, guilt reminds us. So it's an important moral sentiment. But again, like many other emotions, guilt, unless you're able to regulate it in a constructive way, at some point, then guilt becomes more about yourself. There's a kind of a self-directed loop. And when that happens, it's not very good. It's not very healthy, because it makes you more worried and more guilty and more, sort of tired. And also, and the interesting thing about human psychology is that anytime when the focus becomes too narrow and excessively upon ourselves, then the world sort of shrinks. And that's this is one of the reasons why in all the contemplative traditions, there's an emphasis on opening up from the individual ego, to the broader view. But in the case of, and the guilt is a very natural response in this situation. For example, not just healthcare providers, but also ordinary people. We know, for example, many people have lost their jobs. Now, those of us who are able to work from home, we feel guilty. Because for example, I have several cousins in New York, and two of them are doing a live-in nanny, used to do live-in nanny, and they all grew up in India. And two of them are, one is driving a yellow cab and one is driving Uber. I mean, during this period, they haven't got no job. So I know in my own personal life, there are a lot of people who are way less fortunate than I am. So I think in these instances, I think we should clearly acknowledge our good fortune, but then find a way to translate that emotion, recognition, not towards guilt, but towards gratitude for what we have, and also find an outlet to do something concrete. So for example, the healthcare providers, even though you may not be at the forefront of dealing directly with COVID, but there is still a world out there. There are still patients with other illnesses. And that was one of the things that I have worried right at the beginning, because my sister is a nurse practitioner in the Boston area. And one of the things that I asked her was that because there's so much focus on COVID-19, what about all the other regular healthcare needs, particularly the elderly, who are in assisted living and all of this. So I think there's a huge, need for healthcare providers everywhere. And even though there is a global pandemic of COVID-19, many other illnesses are still ongoing. So they need care. And so I don't think healthcare providers who are not directly dealing with COVID-19 should not feel guilty at all, because they're still doing the service. I think, and the more other healthcare needs are met, the larger hospital systems will be taxed, which means it opens up the space for focusing more on COVID-19. So it's all interconnected, interdependent. So, and in any case, not all the healthcare providers will have the space for dealing directly with COVID-19, because although it's a massive pandemic, but in terms of actual numbers to regular illnesses, it's significantly way smaller. So if all the healthcare providers, go there, who's going to take care of all the other illnesses? So I think, thinking along these lines probably, and as much as possible, bringing the recognition of gratitude, the feeling of gratitude to one's own good fortune. And it's not just the healthcare providers, but also many people around the world. And in fact, I was talking to someone on a podcast, and this person reminded me, he said, one of the things that people don't think about is that actually, because during the lockdown period, there's very little space for social spending. So a lot of people are actually saving a lot of money. And he was suggesting that though that portion that we are saving could be actually shared with, poorer members of our extended family, or provide, needs. There are so many needs in the world. So I think we need to find an outlet and then express that feeling of gratitude.
Yeah, and I also think it's so powerful to send compassion to those in the front line. And
exactly.
For healthcare providers, they're so accustomed to being able to show up directly and make change. And this really interesting transition from I am the one who's always making the change to I'm the one supporting those with compassion. That's so interesting and so challenging. And I wonder if we could have you possibly lead us in a way of how do we send compassion to those right now in the front lines? What can we do even moment to moment through the day? Because as we develop awareness of these emotions, we recognize, okay, there's guilt arising. I know the feeling. I feel kind of queasy and awkward. What can I do in that moment? Right? I can practice gratitude of, I am so grateful to have this home. I'm so grateful to have this food, and maybe send compassion. What do you think?
Yes.
Would that be a good combination?
Yeah, I think as much as possible, if we are able to bring to our awareness the services that are being done by especially the healthcare providers, and also the sacrifices that are being made by people in the front line. Not just healthcare providers, they are taking the brunt of it, but also there are many people who are working in the essential services like grocery stores and public transits and all of this, because the world still is out there. And many of these, individuals are really taking a risk. Many of us who are self-quarantined, when we go out, it will be very rare moments, but then we protect ourselves. But if you are one of the staff members in these essential services, you don't really have a choice because someone has to provide these services. So I think every time we see this, I think it would be really helpful to simply, silently, express our gratitude, and also kind of wish them well, because some of them may be feeling afraid. Some of them are feeling afraid, not just for themselves, but their families as well, because in the evening they have to go back to their family. What do? You don't want to risk your children and elderly, family members who are living with you. So there may be fear, I think, being able to recognize and wishing them well and wishing them courage and wishing them hope. I think that's, one way in which we can do. Yeah. And then, when opportunity arises, simply say thank you. I think, even to say thank you for your service. Because I noticed in America, before the COVID-19, I noticed that there is a particular cultural kind of tradition to thank, military people, especially when they're traveling. I've seen individuals stop and say, thank you for your service to the nation. So I think, we can adopt something like that and then, find a way to say thank you. And that way we can wish them well,
Yeah, wonderful. Yeah, and I think at some point we should maybe give people an opportunity to practice that, something that's short, something they can really do in the middle of their day, of how do we maybe feel compassion for our own acute challenge with our difficult emotions, and then how do we extend it out in just that way of thank you, I appreciate you. It's a beautiful invitation and something that we can do in the moment.
Yeah, definitely.
Yeah. So I have a question a little bit around this idea of how do we manage and regulate our emotions. I heard you speak recently on a program around the importance and value of really understanding ourselves. And this is called, in contemplative traditions, first-person introspection. And Alyssa opened up by saying and describing this wonderful bridge between contemplative practices and contemporary science practices. And this is an area they can overlap, right?
Yeah.
We train ourselves to be first-person scientists of our experience, noticing what happens. And I'd love to hear from you. Why does this matter? Why is it important for us to understand ourselves at that level?
I think, as neuroscience progresses with all the powerful technology, when it comes to the knowledge of brain, the expansion of knowledge is amazing, but the brain knowledge, so long as it is not translated into the language of the mind, those of us who are not scientists, everyday people, we don't really have a way of implementing the insights or applying the insights that are discovered. And this is one area where the contemplative approach really offers a possibility, because contemplative approach is really from the mind side of the story, how mental processes are experienced, how emotions arises, and what emotions do. So I think here the key factor is bringing awareness. But awareness is, as I said before, you cannot will it. So in a moment of emotional experience, it's very difficult to bring awareness. So the way to do that is to let the emotional episode pass, and then take stock of it, kind of retrospectively, and then as it were, shine the spotlight of awareness on your emotion, and then acknowledge it. But here the key thing is, it's important not to bring judgment, because often we are very harsh on ourselves, particularly in the contemporary kind of Western society, we tend to be very harsh on ourselves. So bringing a kind of a gentle approach, acknowledge them and honor their arising, because emotions are there for a reason. And then the important thing is to then connect the emotions to an underlying, a meaning. So it could be, for example, like you felt in a particular way because you felt threatened. So safety is an important need. So recognizing, acknowledging the emotions arising, connecting them to a meaning, and then that way, and then setting an intention the next time you will respond slightly differently. And then as you practice, then the gap between the actual emotional episode and your awareness will shrink. And then when you are good at it, you may even be able to catch before, what is the saying, before the flame, catch it at the stage of the spark. And that's when, and then you, and the beauty of this is when we're able to do this, then we can live our life in a more conscious way, in alignment with our values and intention. Because when it comes to intention, all of us are very well-meaning, but the reality of life, there's a gap between our intention and the actual reality of the life. So the contemplative practice, at least in principle, promises the possibility of aligning them so there is less gap between how we would like to show up and actually how we do show up. And there the intention and awareness really has to play the role. And of course, the values is where compassion fits in. So if we take compassion seriously, and compassion, I mean, one of the things, beautiful things about compassion is that it's a very natural human quality, not something that we have to learn afresh. It's there, we have this, and this is probably one of the most powerful expressions of our social nature, the empathic creature, social nature. And because it is so fundamental to our, reality, when we're able to tap into this part of who we are, we experience the world differently. And this is why the important relationships in our lives are so important factor for, well-being and a sense of security. Parents will know that when a 2-year-old kid is throwing up in tantrum, the most effective way to calm the child down is not by talking, by giving a tight hug. And you can see literally the effect of the hug on the child. Even the body slows down. That is the power of compassion. And that's the relationality of compassion. So I think, we, as much as possible, if we can acknowledge the important role compassion plays in our life, make it more conscious and bring it more consciously into our equation, into the equation of our interaction with others, that changes everything. And so the healthcare providers, earlier you were talking about resilience. I think one of the ways in which we can, the healthcare, providers are naturally compassionate. The reason why they're in that profession is because they want to serve. So then what happens is that over a long period of career, sometimes as a part of a self-protection mechanism, then you lose connection with the original spark of compassionate intention that led you there. So once in a while, rekindling and reconnecting with that initial spark is a very powerful way to kind of, maintain your resilience. And one of the most important insights in Buddhist psychology is the idea that when it comes to motivation, that will is a powerful force to initially get you there. But if you want to sustain motivation, you need to bring joy. Without joy, it's very difficult to sustain motivation. And the way to bring joy is not in the form of pleasure, but in the form of a sense of fulfillment. So if your initial motivation is to really to serve, and it's compassion, then if you're able to live it out and connect with that, stay connected with that intention, every time you're able to make a difference, you get a sense of fulfillment. That's where joy comes in. And when you have a joy, and even your brain subconsciously make connections with that thing, I like it, and that's how the motivation can be sustained. And that's also the basis of resilience.
Yes, you're weaving so many important pieces there together. One thing I just wanted to mention is this ability to feel compassion, of course, for our crying child is the same we would apply to ourselves, which is so lovely. And an encouragement to healthcare providers to use that retrospective awareness, meaning to reflect back on difficult emotion experiences with another person. So these practices of really sharing, wow, today I was so frustrated. and I acted in a way that was harmful. If we do that on our own, we may kind of overgenerate that sense of self-criticism. If we share that with someone, we actually develop more empathy, more understanding. There's been research on this. We share what we think other people won't like about us. They like us more.
Yes.
We've revealed the vulnerability, and that creates another kind of joy, and a joy of connection with others. And such a powerful process of emotion regulation happens when we're with other people, right?
Yes.
So we have our own skills, and then we have this capacity with our trusted colleagues and friends to create that resilience through connection. So,
True.
yeah.
Beautiful. Yeah, that's the power of relationship and the social kind of, the social, where, one of the exciting things that is happening in science right now is a deeper appreciation of what it means for human beings to be a truly social creature. So this, initially there was a lot of emphasis on brain, which makes perfect sense. Now there is a kind of a social dimension, and now there is a recognition that actually many of the things that we are doing are motivated by our social nature and seeking, a sense of, and for example, like social connection is now recognized as one of the most important factors, not only for happiness, but also for longevity. There was a longitudinal study that shows that one factor that can predict, that was done, the test was done when the men were in their 50s. This was done on men, and they were re-interviewed when they were in their 80s. So during the period of 30 years, one thing that predicted longevity and happiness in the age 80 when they were interviewed at 50 was really the sense of social connection. The perception that you have people in your life that care, that love you.
Yeah.
It's so powerful.
And it's one of the big predictors of the healthy longevity of living without disease for a long time. This has been a gorgeous conversation. Thank you so much. And I had to jump in with a few questions as well. One is, as you're talking about our connection to others, I'm wondering if you can just describe for us this idea of common humanity. We don't talk about common humanity and feel the interconnectedness. That's not what we, that's not the Western mindset that we grew up with, of course.
Sure.
Whereas it is such a fundamental part of the experience of growing up, for example, in Tibetan Buddhist framework. You see and feel the interconnection. And at this moment, we have an opportunity to see that and feel that more, but we don't have the language. We see the common suffering. That's not hard to see. But I would just love to hear you talk about what is this common humanity idea and how can we really work with that more?
I think right now, Elisa, you're right. Right now, the time is perfect because people all over the world are really feeling this sense of connection. Because when the global pandemic was declared, our initial reaction is shock and fear. And then recognition dawns upon all of us of the fragility of everybody. And then there was a real recognition of shared humanity. It didn't really matter where you were from. In the face of this COVID-19, everybody was equal. Everybody was vulnerable. Nobody was immune to this. So there was this recognition. So the common humanity idea is, for example, like in the way in which I've conceptualized compassion training, we use common humanity as the bridge to move beyond our immediate circle of concern. Because as I said earlier, the compassion is a very natural human response. For the strangers, we generally tend to leave it only at the mercy of extreme situations. But normally, we tend to reserve that compassion and empathy to a small group of people, our loved ones. And then maybe if you are, a nationalist, to your own country. But beyond that, then there is us and them. That's the tribalism side of human nature. So common humanity idea comes from Buddhism, where the key idea is that in order to bridge it, move beyond this normal tribalism, us and them, you need to make a connection beyond that small circle. And you need to find a way to identify, because if you're not able to feel connection with someone and identify with the other person, empathy is not going to kick in. And if empathy doesn't arise, there is no place for compassion. I know sometimes people give a bad press for empathy because it's a potential source of burnout. But that's, I think, misguided, because without empathy, there is no route for compassion. And empathy only arises if we're able to feel connection with someone. And that connection in the Buddhist training is established on common humanity idea. The common humanity idea, simply put, is the recognition of the other person at a very fundamental human level, where just like me, he or she wishes to be happy. Just like me, he or she wishes to be free from suffering. So, and then the idea is to cultivate that perspective to a point that you feel it viscerally, not just intellectually. And this is why, someone like His Holiness, the Dalai Lama, or Archbishop Desmond Tutu are so compelling, because they have that ability to connect with you initially, right at this fundamental human level. In their presence, we feel ourselves complete. We feel we don't have to prove anything. We don't feel judged. And that is the beauty of that, because they are relating to us at that very fundamental human level. And I think this is important, at this moment. I think this ability to feel common humanity and the environment and the atmosphere right now is quite poignant, because we don't have to work hard to get the idea. So thank you for bringing that up.
And I think it will be important to recall those words and those feelings when we see people violating our values. So all of a sudden, America's full of some people, doing social gatherings that we feel threatened by, and to think in their mind, they're seeing this so differently, and
Yes.
feeling trying to not feel hostility and anger, but to actually feel compassion for how they're thinking and feeling. It's going to be very challenging.
Yes, yeah, it will be. Yeah, definitely. Yeah. I mean, the moving forward, I think it's because my hunch is probably this social distancing, all of this probably will be in place for at least a year, because with all due respect to the various governments who wanted to open up the economy, go back to a roaring economy, the human psychology tells us that majority of us are probably not going to be venturing too far beyond, and it's going to be treading softly. So, and during this period, the clashes between those who believe that as a society everybody should take risks, and there should be a herd immunity developed, but we should be more concerned about the economic fallout, versus those who feel that every single life lost to COVID is a life that could have been saved. Two different, perspectives.
Yeah, I have one more question or thought or reflection. Having you describe common humanity and linking it with empathy, so powerful. And I agree with what Alyssa said, is there are certain words and concepts from contemplative traditions that we don't have or understand. And yet, of course, the foundation is already here.
Yeah.
I think this idea of equanimity is one of those that's challenging for people. They think that equanimity means that you don't care, that you're a and so you can have compassion and equanimity. And I wonder if you can help us understand that it isn't just, I deeply care and then I zone out, or I feel a great deal of sadness and then I'm happy again. What does equanimity really mean? How can we hold an understanding of that?
I think equanimity is actually a tougher concept than common humanity. I mean, that's one of the reasons why in the CCT, Compassion Cultivation Training, we don't really bring that concept explicitly too much, because equanimity and even-mindedness can be sometimes seen as a way of suggesting that you shouldn't be loving your children more than others' kids. So that's because the what is being demanded is actually quite high, because we're being asked in the idea of equanimity to love others' children as much as we love our children, not the other way around, because sometimes it's misunderstood. So whereas common humanity is a much more easier concept, but also it's more relatable because common humanity is not expecting us to see everybody equal, in a sort of a conventional sense. Common humanity is asking us to recognize and remember the humanity of any person that we are interacting with. That just like me, he wishes to be happy, just like me, he wishes to be free from suffering. So that's all that is being asked by a common humanity, and that is, and the idea is you train it in general, and then you're able to bring that in your concrete interaction with an individual. So I think that probably is more doable. But the equanimity that the Buddhist practices suggest is probably a much more advanced form, because then you are, for example, in the four immeasurables, equanimity is placed last, because then you're supposed to have arrived at a point where nothing in the circumstances really shake you. But that's a tough one. That's really, whereas common humanity is more like a foundational practice, which can be cultivated. And the difference here is that sometimes people can be seen as using common humanity language to wash away the historical injustices that has happened. So I think they're, sort of balancing this, because common humanity does not say that the specificity of the people's experience and suffering and history are irrelevant. It doesn't say that. Common humanity is about an individual interaction where you're able to bring awareness that just like me, this person wants to be happy, this person doesn't want suffering. And that person's definition of suffering may include a historical pain, which we have to honor. So I think those are important sort of balances that one need to keep in mind.
I want to point people to where they can experience what you're describing in their body, the sense of common humanity, the sense of compassion, away from empathic distress to this softer, more open compassion. So Jinpa has a digital platform that is lovely. It's called Mandala. You can download it and hear some meditations. So we'll have some resources from him on our website. And I urge us, we had too much to talk about today, but I urge you to try a compassion meditation, because it still is a word, but to actually be led through feeling it is a phenomenal opportunity we don't teach in school, right? We may be lucky enough to encounter this type of training in our adulthood. Yeah. And that brings us to,
and the Compassion Institute also offers online CCT. These days we are doing quite a lot of online training.
So we'll list the Compassion Institute too. So going forward, one silver lining, one opportunity of this being a little bit frozen for a while, not with our usual busyness, is for people to recognize the opportunity to learn about their own mind, and that this is where it starts, the suffering, the joy. And so training the attention in this way. So I just want to point to, in addition to the Compassion Institute, to a few other resources. We heard about from Roshi Joan, the Upaya Varela Symposium, also was called Zen Brain. This is an opportunity to go very deep into, again, this contemplative science, the union of neuroscience and modern psychology with Buddhist wisdom. So this is next weekend. It's on our website under the resources. And it's very exciting that it is now in Spanish and Portuguese. So it is reaching our community, brothers and sisters in Brazil, and hopefully the world will get out to the Spanish-speaking people, because this is a very rich, interesting opportunity. Our department's website of resources is going to be translated into Spanish. We have a new webpage that will be up that has resources for Spanish-speaking people. So we're very excited about that outreach. And then lastly, the Brick Foundation, they're a wonderful couple that I've had the honor to meet, Victor and Lynn Brick. Victor lost his brother to mental illness, and he has started a family foundation to find non-drug treatment help, management, cures for mental illness and for preventing mental illness. So I'm very grateful to their foundation. They actually sponsored our Wim Hof study that I mentioned last week. and they are sponsoring a free 3-day mental health summit. Actually, that one's next weekend. The Varela is the following weekend. But anyway, the Mental Health Summit, if you just type Never Alone Summit, you will find it. It's free. There are wonderful speakers from all over the world. It's a global event. And so any last words, Eve or Jinpa?
No, I want to once again express my profound admiration and gratitude to all the healthcare providers, my sister included, for really, for your service to humanity at this very, very difficult time. Thank you.
Yes, thank you so much, and really appreciate being here with you all once again, and being with you, Jinpa and Alyssa and Sanjay. Thank you.
So much, Eve, Jinpa, and Sanjay, and we will look forward to seeing you next week. We will have the pleasure of speaking with Bessel van der Kolk, who is a brilliant pioneer in understanding how we carry trauma in the body and how we can be resilient during this time. He'll be interviewed by our own faculty member, David Bullard. See you next week. Thank you so much, everyone. Take good care.
Nice meeting you.